This is CGTN, China Global Television Network.
Relative calm returns to parts of South Africa after a week of violence. COVAX is failing to halt the COVID-19 pandemic in Africa as deaths surge by 43%. And strawberry-flavored HIV drugs for babies to improve adherence in Zimbabwe. Hello and a very warm welcome to Africa Live on CGTN. I'm Lindy Mtongana in Nairobi. Also ahead this hour. In business, Egypt's external debt jumps 21% in the third quarter of 2020-2021 fiscal year. And in sports, the IOC president, Bach, says there is zero risk of infection from participants at the Games. We start the hour in South Africa, where President Cyril Ramaphosa has visited the province of KwaZulu-Natal, which has been one of the flashpoints of violence in the past week. His visit comes as relative calm returns to parts of the country that have been reporting sporadic violence. The unrest was sparked by the arrest and detention of former President Jacob Zuma. He is currently serving a 15-month jail term after being charged with contempt of court following his failure to appear at a corruption inquiry. The unrest has been marked by looting and destruction of property, leaving behind 117 dead. More than 2,000 others have been arrested, while the army was deployed to help police quell the chaos.
And it's quite clear that all these incidents of unrest and looting were instigated. There are instigators, there were people who planned it, they coordinated it.
Well, vaccines and chronic medications were not spared in the looting in South Africa, with scores of pharmacies destroyed in Gauteng and KwaZulu-Natal provinces. COVID-19 vaccines and other vital medicines have been lost as more than 100 pharmacies were destroyed in the outbreak of violence in the country. CGTN's Yulisa Njamela has more.
Ransacked, looted and destroyed. These are the scenes that confront many pharmacy owners in Gauteng and KwaZulu-Natal provinces.
The destruction has been bad, like terrible, in the sense that in most of the stores that we visited, including stores in our group, there's absolutely nothing that was left. People took everything, all medicines in there, regardless of schedule, everything.
The pharmacies were caught up in the violent attacks that have engulfed South Africa for a number of days now. The attacks were sparked last week when the former President Jacob Zuma was taken to prison to serve a 15-month sentence. His supporters took to the streets to demand his immediate release. Among the items looted at pharmacies are COVID-19 vaccines and scheduled medicines. When they are used without proper pharmacist counseling on storage and dosage, they may result in harm to one's health.
It is very concerning because if you are going to have highly scheduled medicine, very dangerous medicine also, because we know that medicine can do good in healing people, but they can also harm, particularly if they are used without proper pharmaceutical supervision, which we expect will happen when these drugs are out there in the public.
Pasha is one of the first advocates for pharmacy owners to move their businesses to townships and other previously disadvantaged areas.
It is so hurting that you work very hard, like really we had in the country to have services, pharmaceutical services, to be widespread and to reach very disadvantaged communities, and to encourage pharmacists to open pharmacies and all the lay people to open pharmacies in those areas where they were previously really underserviced. If they are now looted and they are now targeted the way that they are, this is going to take back the gains, literally way back. The gains that we have really achieved in taking healthcare to the people.
The pharmaceutical industry is yet to quantify the damage. The Pharmacy Council has voiced its concerns at the losses, as in many cases they say the closures are likely to be prolonged. Yolisa Njamela for CGTN in Johannesburg, South Africa.
Well, let's go live now to Johannesburg, South Africa, where CGTN's Angela Coppola is standing by for us with the latest on the unrest in the country. Angela, of course, Gauteng province, where you are, saw its fair share of violence and looting. But today, the country's president is in KwaZulu-Natal, where all this unrest started. Tell us about his visit to the province.
Well, as it stands right now, KwaZulu-Natal saw fewer incidents overnight. There were no further details just yet. We do know that he's in the country, in the province. That detail will come through a little bit later. But it's been relatively calm, which means that the President and the South African Police Services Minister will be visiting the area. We know that Ramaphosa is going to be doing a flyover, so that means that the security issues are still a little uncertain. There won't be a tour on the ground as far as we know, and that's likely due to the security concerns I mentioned. Before he took off, he did say and made some comments around the fact that it seems like there are instigators involved in planning this. One of those instigators has been, alleged instigator should I say, has been arrested, but there are a group of 12 that are being monitored and surveyed and probably tracked. Meanwhile, the SAPS Minister, Bheki Cele, will be going to Phoenix, where there's some racial tensions that have been high overnight. Communities are still blockading those areas. We'll hear from him about that later, about his impressions, and that's from Ramaphosa, and that follows his discussions with the security personnel and the provincial leadership. Lindy.
Well, Angela, I hope you can hear me. We do know that, as you've mentioned, there is now relative calm in the most affected areas, but there are still soldiers on the streets, and we understand that reservists have been called up for the first time in decades to come and assist. Just tell us about the situation on the ground at the moment.
Well, the troop deployments are underway. Those additional troops haven't yet been gazetted in the government gazette. That's for those 10,000 additional troops that we hear that are going to be deployed. But what we do know is that the deployed troops will be put onto the N2 and the N3 highways when it reopens. Troops will remain on the streets in the hotspots for at least 3 months, we're told, according to a general we spoke to in Alex yesterday. But there are some questions about the number of troops that will be put on the ground. And then, of course, there's the question of the deployment that has to happen to Mozambique under the SADC deployment to the Cabo Delgado region. So there are more questions than answers in terms of troops and troop deployments. Lindy?
Thank you so much. Angela Coppola speaking to us there from Johannesburg. And as he says, calm has returned largely to many parts of South Africa, but troops will still be on the ground for perhaps a few more months ahead. Now, turning to other news, Africa has recorded a 43% rise in COVID-19 deaths as hospital admissions increase across the continent. According to the World Health Organization, the death toll increased to over 6,200 last week. That's compared to less than 4,400 the week before. Daniel Arab-Moy brings us this report.
From Dr. Tedros,
the World Health Organization says COVID-19 cases have continued to rise, with Africa hitting the 6 million mark. In the month of June alone, Africa is reported to have recorded an additional 1 million cases. According to the WHO, the surge is as a result of public fatigue and the fast-spreading variants.
As this surge sweeps across Africa, we're witnessing the brutal cost in lives lost. Deaths have climbed steeply for the past 5 weeks, jumping 40% in the past week. This is a clear warning. Our hospitals are at a breaking point. In all, 153,000 people have sadly died.
83% of the new deaths recorded in the past week in Africa were recorded in just 5 countries: Namibia, South Africa, Tunisia, Uganda, and Zambia. Africa's case fatality rate currently stands at 2.6% against the global average of 2.2%.
The #1 priority for African countries is boosting oxygen production so we can give critically ill patients a fighting chance. Effective treatment is the last line of defense against COVID-19, and it must not crumble. As WHO, we're working with countries to improve treatment and critical care capacities.
The continent has so far vaccinated 52 million people since vaccine rollouts began from March. This accounts for just 1.6% of the 3.5 billion people vaccinated worldwide. Daniel Arap Moi, CGTN, Nairobi, Kenya.
Well, the government in Rwanda has now imposed strict measures, including a lockdown in the capital Kigali, as well as 8 other districts, as COVID-19 infections spike. The new measures will take effect on Saturday. The country's Ministry of Health says most of the cases are of the Delta variant. Now, according to the state minister in charge of primary health care, the Delta variant accounts for 60% of new cases being reported. 9 more people died of COVID-19 on Wednesday, bringing the death toll to 607. Well, infections have also been spiking in Sierra Leone. The government has rolled out new measures, including a nationwide curfew that began on Monday. According to the WHO, the West African nation has now recorded over 110 deaths in over 6,100 cases reported. Last week, the U.S. Department cautioned its citizens against traveling to Sierra Leone due to rising cases. It said there is a high risk of contracting severe symptoms of COVID-19, especially for those who have not been vaccinated. Well, earlier we spoke to Professor Sarr, the technical group coordinator of the national COVID-19 response in Sierra Leone. The professor told us more about the COVID-19 situation in the country.
We saw some increase in numbers, and then after that there is a decrease since that time. Over the past 1 week, there is a decrease. The main reason why we saw an increase in numbers was actually people really not adhering to measures put forward by government. People are not adhering to face masking, people social distancing. And then with what is happening in other parts of the world, the vaccination rate is really, really low. I think as I speak, less than 2% of the country really is vaccinated. So all those things would have been compounding factors for the increase in numbers that we saw. The health system is definitely not overwhelmed. It's not overwhelmed with what we are seeing. We have the number of beds that we have occupied. We have about 1,000 beds capacity currently, and the bed capacity, bed occupancy is about 42% currently. So we have a large number of beds. I must hasten to say that we are very fortunate to have the high support of government in the COVID response, because we have what we call the Presidential Task Force, and that Presidential Task Force is chaired by the President of this country. And the COVID response in this country briefs the President on a regular basis. So definitely there is government support, and the government really, is actually providing every support necessary that is required by the COVID response. The next thing that government is looking at really is having more vaccines provided in the country so that as many people can be vaccinated as possible.
Well, CGTN also spoke to Dr. Ahmed Ogwel Oma, the Deputy Director at the Africa Centers for Disease Control and Prevention, about the new surge in COVID-19 numbers across Africa.
We are not in a state of helplessness, but it is true that the continent is undergoing the third wave, which is much more severe than the first and the second waves. The reason why we are not in a state of helplessness is because we know what needs to be done. And as Africa CDC, we are supporting our countries to institute those public health measures that will result in bringing down the numbers. And we are also engaging in ensuring that all tools for responding to COVID-19 are made available on the continent.
The COVAX vaccine initiative, some would say, appears to have failed. It has now delivered roughly less than 90 million doses of the 2 billion it was supposed to deliver by the end of 2021. What then is the plan B for the African Union and the Africa CDC?
For us at Africa CDC and the Africa Union, we appreciate the very useful platform that COVAX actually is in as far as mobilizing COVID-19 vaccines for the globe. But within the African continent, we are not relying solely on the COVAX facility. We have also the African Vaccines Acquisition Task Team that was set up by the President of the Union in 2020, His Excellency Cyril Ramaphosa. And that particular task team has been mobilizing manufacturers, negotiating so that we can be able to have vaccines on the continent.
As the Africa CDC, realistically, what kind of support do you need and even expect from developed countries?
What we would ask from the international community is three things. One is make vaccines available. And we are not saying that we want them for free. We are willing to purchase, and it is access now, not access next year or the year after. This is the first thing that I would really like for the international community to be able to appreciate. The second is that the African continent is part of the global community. And if it is not adequately covered by vaccines, then we will still have a global problem of COVID-19 continuing if it is not covered. This is the second thing. The final thing is to let the international community know that a pledge is only as good as when it is delivered. If you make a pledge and you do not deliver, then that pledge is not really helpful to the African continent. The pledge that is delivered is the pledge that is going to be helpful to us here in Africa.
Coming up, the death toll climbs to 100 in floods devastating parts of Germany and Belgium. And coronavirus cases spike in Tokyo just a week before the Olympics. Africa is a continent of diversity, with varied climates and enchanting geography, and a people so distinct, but with a shared enduring spirit. We are at the heart of the continent to bring you the untold stories. Let's have a look. We celebrate Africa as it shapes its own destiny.
Tunis, Cairo,
Juba, Johannesburg,
Ethiopia, Tanzania.
Africa Live. Find your voice.
Nyami was very, very strong, had very, very strong mysterious powers, bigger functional powers than the smaller gods.
Nyami was annoyed in a way, hence making that those floods so that the people could perish.
There was a conflict. 9 people were killed as a result of that resistance that took place.
Instead of calling it a disaster, they've made a ceremony out of it. As the water is flooding, people start moving to the highland. The significance of the Komboka really is just to come out of the water, wait for the water to recede so that you can go back.
Right, we start in Europe, where record rainfall and flooding has left at least 100 people dead and over 1,000 missing. Torrential rains in Germany and Belgium have caused rivers to burst their banks, destroying entire towns. Hundreds have been evacuated in both countries, and army troops have been deployed to help rescue efforts. Thousands of people are still without power. Officials have called the unprecedented flooding catastrophic, and Germany's Interior Ministry has blamed it on climate change. France, the Netherlands and Switzerland have also been hit by heavy rains. Now, public concern over the COVID-19 situation for the Tokyo Olympics is increasing. A number of cases have emerged among athletes and personnel since June. On Wednesday, several Olympic teams were forced into isolation after they had close contact with confirmed cases. The arrival of the refugee team was delayed because an official tested positive, and on Thursday, 8 members of the Kenyan women's rugby team were identified as close contacts of a positive case. Another Olympic athlete is in quarantine after testing positive, but their information has not yet been released. Chinese State Councillor and Foreign Minister Wang Yi will be visiting Egypt on a 3-day trip. The visit will tackle ways to boost the two nations' comprehensive strategic partnership, which has been growing significantly in recent years. CGTN's Adel Al-Mahraoui has the details.
Chinese State Councillor and Foreign Minister Wang Yi is visiting Egypt from the 17th to the 19th of July. The visit marks the 65th anniversary of the establishment of Egyptian-Chinese diplomatic relations. It also follows the 100th founding anniversary of the Communist Party of China, an event Egyptian President Abdel Fattah el-Sisi was keen to mark with a congratulatory video dedicated to Chinese President Xi Jinping.
The visit emphasizes the strong relations between the two countries. This relationship was established in May of 1956 after Egypt's recognition of the People's Republic of China at the time of former President Gamal Abdel Nasser.
Since then, ties between Egypt and China grew tremendously. Wang Yi will be meeting Egyptian President Abdel Fattah el-Sisi and a number of cabinet members to discuss a wide variety of topics to cover all aspects of the comprehensive strategic partnership that binds the two nations together.
The most important topic that will be tackled is the Chinese investment in Egypt, especially in the Suez Canal. They will also discuss the Silk Road initiative, which China has heavily invested in.
The Chinese State Councillor will also be discussing regional crises with the Secretary General of the Arab League. Wang's entire visit is in the coastal city of New Alamein. China is building 5 high-rises in this Egyptian national flagship mega project on the Mediterranean Sea. Wang Yi last visited Egypt in January 2020. This month, Egypt began manufacturing Chinese COVID-19 vaccines domestically. China is supporting Egypt with full transfer of its vaccine production technology. Wang Yi will be discussing with Egyptian officials how to capitalize on that achievement and support African nations with the vaccines they need. Egypt has doubled its production target from 40 million to 80 million doses by the end of the year. Adel Mahraoui, CGTN, Cairo.
Ethiopian National Defense Force General Bacha Debele has announced that the army is now officially engaging rebel TPLF forces in the Tigray region. This after Prime Minister Abiy Ahmed announced the unilateral ceasefire declared by Addis Ababa was unsuccessful. Here's CGTN's Girum Chala with more.
Lieutenant General Bacha Debele, addressing the media, said the Ethiopian National Defense Force is now in a counter-attack mission, taking retaliatory measures against the TPLF force. The general said this renewed war will guarantee the sovereignty and territorial integrity of Ethiopia.
This is war, and this war is about sustaining Ethiopia as a sovereign. And it's about making sure the intention of TPLF to dismantle Ethiopia fail in all aspects. We will assure you that we have devised a carefully thought-out attack plan using our forces.
Last month, the federal government announced a humanitarian unilateral ceasefire in Tigray. TPLF leadership rejected this move and promised to continue defending Tigray's territories until what they called alien forces are fully out. Prime Minister Abiy Ahmed on Wednesday officially announced the failure of that ceasefire.
In our country, if we look back and carefully observe the behaviors of this group, Always conflict and war create favorable conditions for them to grow and prosper. This is why they failed to accept the unilateral ceasefire opportunity given to them.
Addis Ababa also accused TPLF of using children for war.
As the global community has seen, TPLF is using and recruiting underage children for war. These are the kids being used as soldiers to fight against the national army.
Widely circulating reports suggest that alongside the military, special police force from Amhara, Oromia, Sidama and South regional states are also engaging the TPLF's army. Grumjala CGTN, Addis Ababa, Ethiopia.
A report by human rights group Amnesty International has revealed new evidence of the abuse of migrants intercepted at sea and forcefully returned to detention centers in Libya. CGTN's Jane Kyo brings us more details on the story.
The report on migrants by Amnesty International focuses on those intercepted in the Mediterranean and returned to Libya in 2020 and 2021. Details of worsening conditions in migrant camps have emerged, while some describe experiencing sexual violence at the hands of the guards.
For instance, in one center that's specifically designated for vulnerable groups, formerly detained women told Amnesty International that they had been that women at the center had been raped by guards, that they that they attempted to coerce them into sex in exchange for food or clean water, and that those who attempted to resist were severely beaten.
The new findings follow multiple such reports that have emerged since 2017 of the mistreatment and torture of migrants.
This is very significant as this year the Libyan Coast Guards have intercepted and returned around 15,000 refugees and migrants in the first 6 months of 2021 alone. This is more than all of last year combined.
United Nations Secretary General Antonio Guterres has called for the closure of the facilities.
There is a very large disparity between the number of those that were taken to these centers and those that are registered as or have been counted as remaining in those centers. And the report highlights a number of ways that individuals may leave or be removed from detention, either by escaping, by paying ransoms for their release, by being transferred to other centers, at times due to death because of cruel and inhumane detention conditions, by denial of access to medical care. And it's very concerning that there's no secure or comprehensive registration system that allows the tracking or tracing of their ultimate whereabouts.
Amnesty International is urging European nations to suspend cooperation on migrant and border control with Libya. Despite a truce between Libya's warring factions since October, armed groups are said to still hold power on the ground, with some controlling migrant camps. Jin Keo, CGTN.
And coming up in your business news, Egypt's external debt jumps 21% in the third quarter of the 2020-2021 fiscal year. And economic activity for East African countries expected to pick up in 2021 with a 3% growth.
It's just taken me completely out of my depth, but at the same time, it's exciting. It's new, it's different, it's a challenge.
It's really exciting.
Africa Live. Find your voice.
In your business news, the industrial property sector in South Africa is showing signs of a recovery, suggesting the economy is on the mend. However, the recent rioting and looting in some provinces may delay a full recovery. Sumitra Naidu has more.
Warehousing has grown in South Africa as more businesses stock up to cater for the consumer. With the manufacturing in recovery mode, the demand for large industrial factory space has increased too. According to the latest F&B property broker survey, only the industrial sector has managed to recover to pre-lockdown 2020 levels.
It was to be expected that when lockdown came, market activity dropped quite radically. It was very difficult to do property transactions last year in the second quarter. And so we saw big drops in our broker, F&B commercial property broker surveys in industrial, office and retail and hotel property for that matter. Hotel probably the most severely impacted by far, although that's a smaller one of the sectors. But, it was disrupted, it was shut down, there was very little you could do. And so it started coming back reasonably well.
The supply-demand balance for the industrial property sector is showing growth. This is some good news as it is an indication of an uptick in economic activity.
The best of the three big sectors is industrial. It's the most affordable, so I think it's least threatened by affordability constraints. And, warehousing space is highly adaptable as well. You can use, I've even heard of people using it for sort of makeshift offices. You can use warehouse space for a lot of things in financially tough times. But there's the increased interest in logistics because of the e-commerce drive to get new depots nearer to your end consumer and so on.
The growth outlook, though, will most certainly be adjusted considering the mayhem in South Africa currently. There's been widespread looting in two major provinces of the country, affecting warehousing, factories, storage and logistics.
Nothing's really very strong at the moment in a recessionary environment or an economy struggling to emerge from recession. Manufacturing took a big knock last year, and I'd say the manufacturing part of property, of industrial property, did less well last year.
The ongoing looting and destruction of property is a massive setback for South Africa. All efforts were being concentrated on vaccinations and reviving this weak economy. In most areas, building and construction has either slowed or stopped. Investments may also be put on hold or withdrawn. It's a real blow to efforts in getting this economy back on track. Sumitra Naidu, CGTN, Johannesburg, South Africa.
Egypt's central bank has announced that the country's external debt jumped 21% in the third quarter of the 2020-2021 fiscal year. This as total external debt rose to $135 billion from $111 recorded in the same period in the previous year. And as CGTN's Yasser Hakim now reports, a decline in forex inflows amid rising expenditure to curb the pandemic have led to soaring debt.
Egypt's external debt is piling up. It has increased extensively since 2016, as the government allocated funds for extensive economic reforms and a rebuilding process after years of political instability following the 2011 uprising, and has risen even further due to the outbreak of the COVID-19 pandemic. Egypt's government was forced to tap the debt market again in 2020 to cover the losses incurred by the pandemic-induced slowdown, which led to a 21% jump in loans the last year.
Of course, this is a very high number, but it's still in the safe zone for debt. It is calculated through the ability to repay, the growth rates and payment facilities. So far, all are good and positive. The loans are 37% of GDP, which is still a safe zone. These are two sources of the debt, the loans and bonds. In the last quarter, loans were $50 billion and bonds totaled $25 billion.
To bridge the gap without putting a burden on the state budget, the government has been reverting to long-term loans with maturities of up to 20 and 30 years. But it's not all gloom for Egypt's forex inflows. The country's main source of hard currency, such as remittances from expatriates and revenue from the Suez Canal, have been on the rise. However, more effort is being done to support ailing resources, such as exports, foreign direct investments, and tourism, which have been battered by the pandemic.
There are several initiatives being made in Egypt to attract investments with new regulations and facilities. Also to attract tourists, we've seen the government opening up new museums, the return of tourists from East Europe and especially Russia, which is an important market, and improvement in infrastructure. The country is seeking to receive more tourists from Russia, who at one time reached 3.5 million and earned the state about $4 billion in revenue.
Finance Minister has not ruled out another plunge in the debt market, but has stated this move will be less frequent moving forward. The strategy, authorities say, is to reduce total debt from 90% of GDP to 70% of GDP by the 2024-2025 fiscal year. Yasser Hakim for CGTN, Cairo.
The National Railways of Zimbabwe says it's lost more than $1.6 million during the first 6 months of 2021 due to the COVID-19 pandemic. Now, according to the company's board chairman, the state-run railway lost about $516 million in potential revenue during the first quarter, while the second quarter saw losses exceeding $1 billion. CGTN's Farai Mokutuya has more from Harare.
The state-owned rail company, which provides bulk freight services to key sectors including energy, mining and agriculture, says a slowdown in global markets due to declining mineral prices as well as delays in approving investment projects and the redirecting of resources to healthcare instead of fuel and grain imports have reduced demand for its services and resulted in the loss of business which it had anticipated for 2021. A company statement said $516.4 million in potential revenue losses had been recorded during the first quarter of the year, while over $1.143 billion had been lost during the second quarter. The losses extend a COVID-19-induced slump which began in 2020 when the company moved 2.5 million tons of cargo, down from 2.8 million tons the previous year. They also compound long-running viability challenges for the ailing state-owned enterprise, which has failed to attract investors to upgrade a dilapidated rail network and purchase new locomotives and wagons. Farai Mokutuya, CGTN, Harare, Zimbabwe.
Audit and consultancy firm Deloitte expects East African economic activity to pick up in 2021 with a 3% growth in comparison to 0.9% in 2020. In its update on the economic impact of the COVID-19 pandemic in the region, Deloitte says growth will mainly be driven by private consumption and domestic demand. The outlook projects recovery to be accelerated by tourism, agriculture and manufacturing, which were greatly hit by the pandemic. The region is estimated to have lost $4.8 billion in international tourism receipts in 2020, owing to a ban on international travel and national lockdowns across the globe that subsequently resulted in the loss of 2 million jobs. The National Bureau of Statistics of China has released the country's economic statistics for the first half of 2021. Zambian economist Trevor Hambai brings us some insight on what the numbers mean for the rest of the world.
The good performance of China is positive for the rest of the world as well, because China, being the second largest economy in the world, also drives economic growth around other countries. So what you do see currently is that the commodity prices on the international market have all gone up because of the demand that is being created by China. And this has been positive for other countries that are recovering from COVID to be able to take advantage of this. This is going to help them also recover, because then they are able to supply their goods to China, who's driving industrial growth. And I think this is very positive for all the other countries.
Tens of thousands of homeless people have been staying in hotels across the U.S., paid for by federal programs aimed at preventing the spread of COVID-19. But with case counts declining, officials say it is time for the homeless to return to shelters. Karina Huber has more in Montpelier, Vermont.
At the height of the pandemic in New York, the city moved tens of thousands of homeless people out of crowded shelters into roughly 60 hotels to try and reduce the spread of the virus. Milton Perez, who has lived in a hotel for over a year, said it was a huge relief.
There's no privacy in the shelter. The bathrooms are not cleaned. People feel human.
The program reportedly cost the city $1 million a night. With COVID numbers down sharply, officials now want hotels to get back to their regular business of servicing tourists.
It is time to move homeless folks who were in hotels for a temporary period of time back to shelters where they can get the support they need.
The same thing is happening in other parts of the United States. In Vermont, officials spent $79 million on hotel vouchers for much of the pandemic to house roughly 2,000 homeless households. Now that most Vermonters are vaccinated and the state has reopened, the program is winding down. The governor says it is not financially sustainable, but homeless advocates worry about the impact.
They don't know where they're going. They're scared to death. I mean, there are people who are literally scared to death.
Families with children and disabilities can remain in the hotels, along with the elderly and victims of domestic abuse. The rest will be given $2,500 and help in finding new housing. In New York, the removal of homeless people has been halted for at least a week after a federal judge ruled that people are not being adequately assessed for health issues before being moved. The city says it will make minor adjustments to the process to ensure people with qualifying disabilities are not moved, but it remains committed to getting homeless people out of the hotels.
Whether it's mental health, whether it's substance abuse, domestic violence, all these services are given to individuals within that shelter system as they tried to do it in the hotels, but the perfect setting is within the shelters, and that's our goal, to get them back into that system.
Karina Huber, CGTN.
Well, that's where we leave your business news. Let's take a short break now. Here's what's still ahead on Africa Live. Strawberry-flavored HIV drugs for babies to improve adherence in Zimbabwe.
Join us in Global Business and see Africa through our eyes.
The greatest journeys, the greatest sights, the greatest adventures.
Here in Kanata, this weir allows the locals to walk on water.
We're far more than just TV news. We're your passport to the wonders of Africa.
To bring you stories of struggle, survival and hope.
So let's explore. CGTN. See the difference.
A new strawberry-flavored tablet for children living with HIV is giving hope to Zimbabwean caregivers that they can keep more children on life-saving treatment. Zimbabwe is among the first 6 African countries to receive the new medication, which is being distributed by UnitAid and the Clinton Health Access Initiative. CGTN's Farai Makutuya has more.
3-year-old Felani Sekenya was born with HIV. He is underweight and cannot walk yet. His mother believes the problems are because he has not been taking enough antiretroviral medication.
I used to mix all the medication together because it was bitter, but he would spit it out or vomit. I even tried giving him sweets soon after he took the tablets, but that didn't help. So his viral load kept rising because he wasn't taking the full doses.
In June, Felani was moved onto a second line of treatment, which includes the new strawberry-flavored dolutegravir.
When I give him that, he doesn't spit or vomit. It has also helped improve his appetite because he's eating better now.
This new drug formulation has created a buzz and excitement not just amongst parents and caregivers, but also stakeholders in the sector who think that it is so important it could mean the difference between life and death. Because most children cannot tolerate the other unpalatable medications, many default on treatment.
That means, children die, premature death. Obviously, these are some of the challenges. They don't return to care because they feel that this is dire because, even though they get the medication, the children will not take the medication. So it makes it very difficult, to keep returning to care. It's been a big struggle. This drug, we call it PDTG or PIDS-DTG, is a game changer because it means, a lot more children will have access to this drug. It's easier to administer.
It's also more affordable.
For Chai and United to, go ahead and push and negotiate for these price changes, for me it's really exciting. Like I said, even for our countries, that means they're able to have some savings. Where they would have been paying 480, they're paying 120 now, which is a great deal. And I'd like to think that, we're able now to avail better drugs to our children.
According to UNAIDS, 71% of HIV-positive children in Zimbabwe are on antiretroviral treatment, a figure that is hoped to go up with the addition of the new drug. Farai Mwakutuya, CGTN, Harare, Zimbabwe.
Now, about a year ago, Nigeria was certified free of the polio virus. It was also the final country in Africa to receive that certification. But in a new twist, there's been an outbreak of vaccine-derived polio virus in some parts of the country, threatening to derail the successes recorded in the fight against the disease. Our correspondent, Deji Bedmus, tells us how the country's health authorities are dealing with this emerging health threat.
In August 2020, the World Health Organization declared Nigeria wild polio virus free, a disease which has left thousands of children in Africa paralyzed. As the country prepares to mark the first anniversary of achieving that milestone, health officials are now having to battle a new vaccine-derived variant of the polio virus, which has now been detected in 13 states and the nation's capital, Abuja.
The variant that we're getting now, which is the type 2, oral polio vaccine virus, is coming now because we have removed from the vaccines we've been using. So we've been using what we call the bivalent. So a large cohort of children have not had the type 2 vaccine. And therefore, it was very easy for this variant that has been circulated in an unhygienic, unsanitary environment to infect such children that have had no coverage whatsoever.
We have conducted 4 outbreak responses using the novel oral polio vaccine, which is preferred as a choice as it doesn't seed the virus. However, suboptimal performance has been recorded in all the states due to high numbers of missed children during the outbreak responses. This poor quality will affect how we are able to bring this outbreak under control.
There are concerns Nigeria is at risk of losing its polio-free status as a result of the new outbreak. But Nigeria's top polio expert says it is not a cause for concern, at least at the moment.
There is no threat whatsoever. The wild polio virus is quite distinct from the circulating vaccine-derived virus. So, that is not, going to be the case. Before WHO certifies a country as polio-free, it's a rigorous process that took place, and that process, cannot be reversed. And because we have a very robust surveillance system, that is why we are able to discover these new vaccine-derived viruses, even from environmental samples.
Authorities say there's been a reduction in donor funding for polio, and that could pose a challenge in efforts at confronting the current outbreak of this vaccine-derived variant of the virus. Health officials say they are now relying on the influence of traditional and political leaders to drive awareness on the need to resuscitate the funding. Deji Badmos, CGTN, Lagos, Nigeria.
Let's take a short break now. Your sports news up next.